to start by sharing a personal story with you. I had a brother growing up from a big family, and as a baby, he was diagnosed with a congenital heart defect. So as he was growing up, he was in and out of the doctor, and many doctors, quite frequently. So one day, the doctor told my mother, he was a cardiologist, your son needs to go in and have a procedure done, and I will communicate the information to the other doctor who's performing the procedure, because he really needs to have a prophylaxis of antibiotics before he has a procedure to protect his heart. So we go in for the procedure, and the doctor did not know that my brother had this particular defect, nor did he give him the prophylaxis he needed. Within 3 days after he had the procedure, he became quite ill, to the point he ended up in the hospital, had IV antibiotics for 6 weeks, and it severely damaged his heart. That is really a classic example, especially with people who are really ill in chronic disease, where having the information that you need as you're being handed off between one provider and another becomes so critical. Another example of that could be in the emergency department. Let's say that you're caring for your elderly mother or grandma. Grandma falls and breaks her hip. The ambulance comes, they take her to the hospital. What medications is she on? You may have grabbed all the medications that are grandma's dresser and put them in a brown bag, and you give them to the emergency room doctor. How do you know which medication is accurate? They could have been sitting there for a long time. You have no idea when the last medication was given or what was been filled. So an HIE is able to also, in cases of emergency, pull a synopsis together of the patient's history, what their problems are, the kinds of medications they've been done, if they've had any recent tests and visits. So let's say that you're a patient and you were in the ED a week ago because you had some chest pains, and now all of a sudden you're having those same symptoms again. An emergency room physician may want to proceed and do a whole cardiac checkup again, when in essence, if they had the information at their fingertips, they could have said, okay, they were in the ED down the street last week, and this is probably a case of either anxiety or hiatal hernia, and it would affect their treatment decisions to do things very differently.